Why it didn't start yet, so don't play that music yet, okay? We're not starting yet. We're just still setting up. So part of the trick when we have guests that we don't really want on the show, or when we have to settle for someone, is that we kind of take one of these ferns and you put it close to their face, so it's more the attention. Woohoo! Hey, get me on here. We get more the attention is on me instead of them, so we kind of put the leaves in their face. No touching. Hi, I'm Frank Marino. Welcome to this year's rendition of Between Two Ferns. So this is our guest, Dr. Welcome to this year's rendition of Between Two Ferns. I'm here with my guest, Dr. Mahl. Just leave that alone. So I'm not expecting much. Let's just start off there. I'm expecting this to be worse than Dr. Horvath's interview last year. That was pretty bad. He's not very good at anything, really. Why don't you tell us a little bit about yourself?
Well, as I see it, a very rewarding career as a clinician educator. Certainly, I've dabbled in that, but my real thing that floats my boat, I suppose, is to teach medical students and to take care of those who are the doctors of the future. And I think it's very important that we train those, because someday they'll be my doctor.
Cut this.
Too.
Cut this.
And so,
Okay,
cut him off.
Thank you. All right. So you mentioned about how you hate research, right?
well, I think hate is a strong word. I don't see that as one of my fortes. I see my fortes in the realm of teaching and patient care, direct patient care.
So essentially, you've told me that you've never had an original idea in medicine. You've done absolutely no research, and you stick your finger up people's all day.
I certainly have done some clinical research over the years, clinical trials in the past, and the interferon interleukin-1.
So we get it. You're not very good at research. What do you do with all your free time since you're not doing research like a normal doctor? Do you bake at all? So you never had any license plate that said like ass man or something to do with asses or butts or feces?
No, I can't say ever.
Seems
Do
like
you have a license plate that says micropenis? Are you familiar with the term micropenis?
No. I don't even know what that is actually. Never. Okay.
Do you have a mirror?
I don't like this. Let's go.
Don't touch the plant. Have him not touch the plant again,
Don't
please.
touch the plant, please.
It is so
Very good. This is
Can I have some
my
of this cake?
yes.
Perfect.
This is my co-host Jason Edwards.
Dr. Mahl, I had some constipation, so I took a stool softener. It worked great. I had a bowel movement at 6 a.m. this morning. The only problem is I didn't wake up until 7. I love this guy.
That's fantastic. I'm going to use that one, man.
You can
So gastro. Okay, what? Can you guys just stop with the cake? With no more cake. We've had enough cake. All right. So I'm gonna have to take this away now.
I like cake.
Well, you've ruined it forever.
This guy's
So, Dr. Moore, why don't you tell us about growing up?
So my dad was actually a television weatherman, so we had, a life in meteorology and the weather and looking at the weather. So I just had clouds and tornadoes jammed down my throat when I was a kid.
Well, my dad was an accountant, so every day it was just numbers. All numbers just jammed down my throat. So.
Well, you know what? My dad was a urologist. So you know what I had jammed down my
Whoa!
It was So why don't you okay, that's enough with the cake. Why don't you tell me a little bit about your work?
Well, it's a little bit like this show.
What does that mean?
I spend an hour staring at an asshole.
Okay, that was that was a little.
Well, I do a lot of patient care, a lot of endoscopy. I suppose, like most gastroenterologists, I'm a little behind in my work.
That was a good attempt. But don't act. It's not that fun.
Palpate different organs, and
So you love feeling patients' bodies.
well, no. I think
We can just. Can you shut up, please? Why don't you just
I'm having a great time.
Why don't you just turn it around?
I'm having a great time.
Okay.
Before we go on any further, I just want to say I had you during a rotation, and you were one of the most compassionate.
it really.
It's just nice to see people who still care.
Yeah, thank you very much.
You're welcome.
It's good. You know, I don't know when your next colonoscopy is, but the convenient thing is that you can kind of just ask Jason what it looks like up there, since he has his head so far shoved up. Okay. All right. Well, just cut that bit. Cut it. All right.
Well, that's what a normal prostate feels. I mean, the tone is a little loose, but that's what a normal prostate feels.
So let's see. Do you have any published papers or anything?
Let me ask you: have you done any research?
You're acting like this is so easy. Why don't you take a turn trying to ask the questions?
Okay, Frank. When did the pain start?
What pain?
The shooting pain that's going down your leg into your toe.
I don't have. What are you doing? I don't have any pain.
Frank Marino is a 27-year-old
Okay, what do you,
white male appearing much younger than his stated age, quite hirsute with primary hypogonadism,
okay, what do you
who
do?
was seen in the office for leg pain radiating from the perianal area.
Did not have
The
leg pain.
surprising thing is, well, not really surprising, he is virginal.
That's not true.
And Nation of the
No, I'm
Extremities
fully
shows that his
young
left
male,
hand
and
is,
I don't
very
have.
soft and
I don't know
pliable,
what
almost
he's talking
hypoplastic,
about.
but his right hand,
What's
quite muscular,
virgin?
deeply callous,
Virgin?
and
No,
quite a bit
I was-
hairy. Quite unremarkable, except for a hypoplastic testicles.
Dr. Mahl is
and
a
a
65-year-old.
What are you
bald.
doing? What
He's
are
basically-
you doing?
Dr. Mahl is basically bald. He also.
I will kill you.
Dr. Mahl is completely. He's very out of shape. He doesn't have. Here.
One of my other titles is I sit on the Student Progress Committee, also known as the Committee to Throw Kids Out of Medical School, and we'll be seeing you tomorrow at 8 a.m. Bring your lawyer.
You look great. You're not fat at all. The baldness on your head can be hidden by just a regular hat. It's
Shut it, Frank.
well,
8 a.m. tomorrow
your
morning.
shirt. There's a nice
8
shirt.
a.m. tomorrow morning.